Welcome to the Business of Youth Sports podcast. My name is Jennifer Pivnick. I'm the host. I'm also the president of U.S. Sports Club Insurance. Today, we are talking with influential leaders in youth soccer in the state of Texas to discuss the process of safely and effectively reopening youth soccer. Joining us, we have representatives from large clubs across the state that have a significant influence and impact in the soccer community. We also have representatives from Texas Health, and we are going to just have an open discussion to help facilitate the rules and the guidelines of this that we all feel is the best practice. Okay, so to start the conversation, we really just want to look at some of the recommendations that people are suggesting and then discuss the process. Does this make sense? What are your clubs looking at? What is going to be the proper protocol? So if we start with the training space and outlining that training space and looking at the recommendation for what that would look like. Currently, there's a lot of talk about defining the training space to 20 yards by 30 yards on a marked field with a minimum of 10 feet between the fields, and then not allowing more than 10 persons within that defined training space, including the coach. So that is a lot of the conversation of the clubs that have been in Texas. There's been a couple of clubs in California that are talking about even enhancing that to start, where it is a defined training space and then marking each player that they have to maintain 6 feet apart. So I just want to talk about starting that process and what that would look like. Pat, you had mentioned when we had spoke that you guys were not going to go quite that small. You were looking at more of a larger space. What's your opinion?
Well, I think the space that you mentioned is probably enough. Obviously, we're going to talk to our medical people as well, but we were looking at putting one group of 10 players in half of a full-size field and trying to make sure that we spaced out practices, put our practices in a much larger space to ensure that players had more, appropriate social distancing.
Right. And then what do you feel about creating the space between each player so that it is defined and marked? Is that something that is appropriate at this point? Jonathan, do you think that players, if you just define the space to this size, 20 yards by 30 yards, and you allow 10 kids within that space, that is reasonable at this point, or should they be 6 feet apart still?
I think right now with the guidelines being set with still maintaining the 6 feet, I think 10 in a spot is going to be a little bit of a challenge until you actually kind of put everybody there to really look at it. And that's going to be the tough thing on the medical side is what are they going to allow us to do? And right now it's not a lot. So we'll just have to keep listening to the updates on how many people we can have on the field at any given time in a given area. If it's less than 10 people, it's less than 50 people, those will kind of tie in. But I think that starting in the small group format is going to be the best way to begin that. So that your 3v3s, your 4v4s, kind of like what we're looking like on the graph here. And having a defined space will be very helpful. Ultimately, we'll have to see how the kids react to that because they are going to want to congregate towards each other.
Right.
Having attended many of your practices and some of the games, I know that space is important for the functionality of the game. So this could be a great opportunity to really work on just having good game space and play space.
Right. So from a training aspect, what would that look like? So Charles, for solar, allowing the kids to be in a defined space, if they were maintained 6 feet apart, what would a training session look like?
So some of the things that we've discussed with our coaches here within Solar and getting back into these on the field was if the spaces was limited, we were discussing possibly doing some functional training, which is almost position specific training. And so working on the specific functions of a defender, of a back forward. And so we're helping decrease the amount of players that are needed at the session, and at the same time still being allowed to keep the proper spacing amongst the players. And so that's one idea we've shared. Obviously, we've also decided, or discussed just technical training. All technique, one player, one ball, no non-contact, and remain in their allotted space. So those are some ideas we've shared within our club, and we've discussed, just depending on what we're allowed to do and when we're allowed to do it.
Right. So I feel like, what would be really helpful is if, for the training space, because, the point of what we want to do is come together and kind of agree on what the proper return to play protocol is, so that we can submit this to the governor, the city council, the COVID task force, so that it is, again, soccer as a community, that this is your guys' business, defining the right protocol and what makes sense, and presenting it in a way that everyone is in agreement to that. So I feel like the first kind of thing to define in regards to the training space would be, do we agree that it should start with 6 feet apart for the first defined period, whatever that is, 2 weeks? So again, you're maintaining that social distancing, you're still outlining and defining the space, and then adding a layer of protection that it should still be 6 feet apart between. So again, like Charles said, you might only have to do certain specific limited training options, but at least you're kind of getting around the kids and getting them back to used to coming out and providing that comfort level. So do we agree with that would be the very first step back?
I would agree with that. Obviously, we'd be following the advice of our medical advisors and in Texas Health. And so, but the sooner we can get back out and maintain the safety of our players is a key priority, I'm sure, for everyone on this call.
Yeah, I think that starting off with that technical training, I think would be, good, because they've been, a lot of the players have been able to do some stuff on their own at home with video and things like that. But just being back out in an open field space with other people, just in eyesight, that technical training would be a good, in essence, warm up back into activity. And, from our injury prevention standpoint, we're going to be really revisiting and reminding the athletes about what do they need to do to prevent injury as they're getting back into play. So starting off with that 6 foot distancing and technical work, I like that approach. And then from there, over kind of a 2 to 3 week window would be my guess, we would be able to ramp up and start adding more closeness and higher level play.
Yeah, I definitely agree. So, and then also to help minimize contact, because that's kind of the point, right? Like, how do you properly space children out? There's the training aspect, but then there's also the entering the field, the exiting the field. That's an issue. So there's been a couple recommendations of staggering the practice start and end times by 15 and 30-minute intervals. I think there's also been other recommendations of really spacing out the practice times. So, Chris, do you have any thoughts on what FC Dallas is looking as far as practice times?
Yeah, well, with school not in session, we had discussed potentially having use of the fields for longer during the day. Because typically in a youth setting, you would have evening trainings. And obviously, if we can get some of our kids to train in the morning, particularly the older kids that are able to drive, potentially could come in the mornings, and then in the afternoons, and then in the evenings, and be able to stagger the training sessions in a way that people are not in as much contact with one another. And coming back to the last point, I think it's relevant to say that in terms of the spacing and the timing between sessions, I'm not sure it's a one size fits all. I know that most of my colleagues here, you run youth soccer programs for many years, and if you've got an 8-year-old, getting them to understand spacing is not the same as a 15-year-old understanding spacing. So I think for us to be able to educate our staff in terms of what activities we're providing, and that when we return to play, it's probably not returning to play, it's just returning to some type of activity.
Yeah.
And it's not going to look like soccer practice looked, at least in the beginning, when we get back on the field. And that's the challenge for a club our size, and many of the clubs on this call. It's just you have, hundreds of teams and lots of different coaches that are going to be administering this program. So whatever plan we lay out, I think one of the keys is for us to make sure that we're educating our staff in terms of the do's and don'ts. And, spacing is part of it, but I'm more concerned about once they get there, what they're doing. I think we'll have a clearly defined plan, and the question will be, can we follow that plan?
Absolutely. I mean, execution in a business is key, right? Like, you're as strong as your weakest link, and that's going to be, I think that's part of the reason for this conversation, is that at least if the leaders in youth sports, specifically soccer and for this region, if everyone understands what each other is doing and everyone is presenting like a clear, concise message to the parents, to the coaches, to the players, then it will just really help facilitate that process. I think that that's a key in the success of it, implementing. So to continue on with that thought process, there's been recommendations by USYS that players bring their own ball, water, and training bib. So talking a little bit about that, there's been some other ideas of, do you provide them all a bib? Does the coach have one for each player? Do you require that he wash it? I mean, it's, obviously a different process than what it typically is, that most coaches have a bag of sweaty, nasty, smelly bibs, so that won't work anymore. So has there been any conversations on, the recommendation for, what that would look like? Stuart, do you have any opinions on what Sting has talked about for the training bibs? Are you going to provide a new one for each player, maybe change?
Yeah, specific to the training bibs, that hasn't been an item of discussion at this point. I mean, our discussions have been more so focused around the mask element and the spacing and some of the points that have already been raised. So specific to the training bibs, no, we have not discussed that to this point.
So that's a recommendation by USYS. But again, I think that is for the guide of the outline of trying to define what this looks like. These are going to be recommendations. But if each club may have to handle that differently according to, how they have it. Pat, I believe you guys said that you were doing 2 different colors of training practice gear, and that will help solve that problem.
Yeah, we're in a year where we buy uniforms, so our plan from the get-go was to do small group training without contact for a period of time. So there's no bibs needed. But when we got back and were allowed to do training, our logic was that we would have kids bring their 2 training tops of obviously different colors so that coaches were no longer going to use bibs. So that is something that we're doing going into next year. Obviously, we'll have to deal with players that may forget their shirt or something like that. But yes, that's our plan going forward, is everybody's going to have 2 different training colors, and the coaches will not be using bibs any longer.
Okay. There's also been recommendations for having hand sanitizing stations available at each field. Lupe, we had spoke, and you had some really good ideas and thoughts on that. Would you like to share?
Hi. So the hand sanitizing stations, I think, are a great idea. The only issue is now you have kids who are constantly trying to touch it. So the thought that I had, and I've been in discussion with Cisco, which is a national distributor of food and cleaning materials. So I'm in talks with them about purchasing either a barrel of hand sanitizer with a pump or 2-gallon containers from them, and then finding a way for us to safely distribute, having a player bring either their own container if they don't have access to it right now, and filling that container for them safely and having them keep it in their own personal bags, and then just having extras that individual sizes that they can grab if they need to. But I don't think having an actual station there would be a great idea unless you have an adult there monitoring it all the time and making sure that the space is cleaned.
Yeah, and then were you able to make any progress with kind of getting those resources? They were willing to maybe help, kind of share that bulk order that we can kind of share with everybody?
So anybody who's interested is welcome to contact me. Of course, they're nationwide. I've also been in contact with the local truck line in case we do purchase a barrel for our club, and they're willing to take on some of that cost to deliver this out to soccer fields. They would just have to be scheduled. But right now they're out. They're 2 weeks out of getting a new order. So I'm getting final prices on either a barrel or just purchasing the 2-gallon jugs and trying to find out what the minimum maximum is that I would have to order. And also if anyone else is interested, if we could all order it together and then just have it delivered to different locations.
Yeah, that would be good, because one of the problems that everyone is facing right now is that, obviously the recommendation is hand sanitizer, but if you can't find it, then, it's going to be really hard to require that. So, I mean, that's a really good solution and a great resource to share. Another recommendation is for the personal equipment to be placed 6 feet apart. The kids are used to lining their bags up or throwing them, depending on their age. And, I mean, this is just a simple, easy solution for that. Now, to maintain social distancing when it comes to practice, and this discussion is returning to train. This is not necessarily for games at this point. It's just to get the players back to being able to come and get back on the field for training. And so what that would look like. So allowing the parents to watch and allowing the parents to come and hang out. And there's always been this divide between, what the parents want and what the coaches want. And I think that, now's the time that it's appropriate to have the conversation that the parents can drop the players off. They can stay in their car and watch if the facility allows for that and that works, or they have to leave and then come back. So really the discussion for implementing this whole entire process is, what does that look like? Do you allow a manager to stay and help? Do you have an assistant coach? Do you have closed circuit television available that you give access to the parents? And then what does that look like? And then who maintains and watches that the parents aren't congregating in the parking lot or the waiting area? Do you have to have volunteers in place to manage that? And obviously this is going to be facility specific. Hugh, do you have any thoughts on this?
Yes, for us, because we have different locations. Some of our locations, actually, the field is inside of a fence. Mm-hmm. The parents are actually already outside the fence, and most of them, so it would be a lot easier to say, hey, just sit in the car and watch through the fence and be able to participate that way. The others, we would have to ask them to either stay in their car in the parking lot or drop off and come back. The problem that may create is, if something changes weather-wise or something like that, if people have left, now you have some kids that you don't want to put in other cars because we're trying to practice the safety. So I think we have to kind of come up with a solution to where it would resolve whether or not, things change. So probably most of it would be that if they're not driving, that the parents stay at the practice until it's over.
Yeah, weather is a very good point, especially in Texas. It's unpredictable. Ben, do you guys at Albion have any suggestions on how you would facilitate that? Do you have your own facilities, or do you have multiple facilities?
Yeah, we have multiple facilities, but we're similar to you. Our central one, we're quite fortunate that basically parents can park up and directly watch whatever field. But we're similar to you that we have multiple campuses, and for the most part, all our fields are fenced off. But we have spoke about that just drop off and then you go. And then obviously maybe having one of the directors sat out, especially in the changeover time. Of families not congregating or kids aren't just walking off the fields and then joining up in the parking lot. So we'll probably have a director walking about during changeover time just to try and stop that.
Chris, for FC Dallas, do you guys have cameras already available? Is that something that you have that you would share with the parents, or would that just not be something feasible to try to implement?
Yeah, so we have Well, we've got multiple facilities. Some we own, and some we're just renting, like many other clubs. And so I would say it would vary from location to location. At Toyota Soccer Center, we have cameras on multiple fields, particularly one or two fields that we would be on quite a bit. We have not discussed live streaming the content of those training sessions based on COVID. We had discussed that prior, that we were looking at a solution to be able to use for high performance. But yeah, it's definitely an option for us to be able to show parents that feed in real time. At least some of our players, and I would say this is probably more specific to players of, younger players, parents of younger kids. So in terms of where we put kids and what field they're on, I think it might be dependent upon our cameras, our existing camera capacity.
Yeah, I agree. I think the younger kids, I mean, the older kids, the parents are fine, right? Like they're driving and whatever. It's the younger ones that is the stress level for that.
I also think that adding maybe 10, 15 minutes in between training sessions to empty the parking lots, if the parents are allowed to stay on the parking lots, could help as well.
Yeah, definitely. I think there was also discussion about really spacing out the practice times from, the early in the morning to the afternoon. And I think, Charles, you had mentioned some.
Yeah, that is one thing we discussed. Obviously, with everyone being homebound, it's a little easier to get the kids out to the earlier sessions. To kind of piggyback off of what Chris was mentioning, we would look to do our older kids that drive first, maybe get them out there 9 a.m., 10 a.m., and then have the session spaced out possibly in 2-hour increments. And, we just ask our staff they're going to have to put in a bit, longer hours. And so we have a session, say 9 to 10, and then the next session starts possibly 10:45, 10:30, even possibly 11. And we just stagger them there. We discuss possibly 45-minute sessions, and then but the sessions start every hour, and the kids are not allowed out of their cars till that hour time is to start. And so, those have been some discussions that we're looking to maybe implement, depending on when we can get out in our facilities. As mentioned, we all have multiple facilities, so we were looking to have either directors or some of our senior staff help monitor this in the parking lots for us.
Yeah, I think those are all very good points. For some additional talking points that, I really just need to be looked at, and I'm really looking for the recommendation from everyone on some of this, because you can have a good idea, but implementation is really the key. So a club in California, they are getting temperature guns. And Jonathan, I'd be super interested in your opinion on this. They're getting temperature guns, and they are taking the kids' temperature before they're allowing them into the facility. My thought process on that is that's going to create a very long line if you have hundreds of kids trying to come in to do that. So would it be feasible to request that the parent take the temperature prior to the kid coming to practice?
I can defer with, Dr. Blewett's now on the call, and I'll kind of defer to him, but taking the temperature itself is not a very time-intensive manner. We don't use the guns, but we have the forehead thermometers that we're using in the clinics to screen our patients as they're coming in. But I'll kind of hand it off to Dr. Blewett, see what he wants to say.
Hi, sorry I'm late.
That's okay.
I would say you got more control, because we talked about this with the hospital. You got more control if you take the temperature yourself, because you'll have some parents that may not take their temperature and just say that they did. You may have some that, all right, this kid is running a mild fever and they don't report it. Taking the temperatures can be done really quickly. We do it for all our patients in the office now, and you can get that temperature taken within 2 to 3 seconds. And if you got, 2 or 3 thermometers quickly, I don't want something really bad just because someone was negligent. So
Correct. And is there a resource that like clubs could buy those thermometers in bulk? I mean, I would imagine you would need to provide that with the coach so that maybe that's something that the coach or the manager is doing prior to the beginning of practice. Because if you try to manage that, in my thought process, you're going to create a big long line, and kids are kids, and they're not going to just stand in line and mind, right? But if they could make their way in an orderly fashion to the defined training space, and then that's something that the coach would do, but then you would have to have multiple thermometers, and it would have to be time built in at the beginning of practice to allow that. And then, okay, this is kind of a silly question, but my thought is if you do that, right, and you have kids coming to practice, and then now I'm taking your temperature right here, well, haven't we kind of defeated the point? Because now they have a fever and they've now exposed themselves to everybody else? When if we require them to do it before they come, then you're minimizing the interaction already?
And that is a good case. I mean, you got the case that, you got people there. The kid's already there with the fever. Now, if they're spaced out 6 feet apart, then it may not be the exposure. Big them taking the temperature. Is it true? Is it, do you have a true temperature? Did they really take it? Mm-hmm. You gotta be willing to trust your parents and making sure that they're doing that correctly. Which it would be the easiest way to do it, but it just wouldn't be. It may not as you take. Yeah, you can buy the thermometers in bulk. It's just a matter of saying how many you need and getting those ordered.
Right. And then also, I think a point on talking about like masks and coaches in masks and players in masks. And I'm really interested in the medical opinion on this is it feasible? So it's understandable for a coach to begin, like that makes sense. They're not typically the ones running and doing that. But what safety concerns do we have for children trying to breathe in a mask and train? I can barely breathe in the mask because I'm walking to the grocery store. So imagine trying to run in that.
Right.
So is that?
I'm gonna tell you.
Go ahead.
No way that you're conditioning in a mask.
No exercise.
You're right. I mean, I wear it in the office, and I have to take it off at times just to get fresh air, because I mean, there's no way I would be able to train, run, condition with a mask. Especially a kid. Mm-hmm. It's going to be virtually impossible to do that. So, I mean, I don't know how we would be able to reinforce that. I think from that standpoint, if the clubs, whether it's the MLS or college or whatever, if they feel like the athletes have to participate in masks, they're still not going to let the athletes participate or train, just because that means that because they know they won't be able to do that effectively.
Right, and I feel like part of the problem is going to be if the city is requiring that you wear a mask to be out in public, then soccer would have to follow that guideline, right? And if that applies to a child, then the entire return to train problem is going to rely on requiring that mask. So then the answer to kind of the next step of that question would be, if you're wearing a mask, do they make ones that are like thin enough and that you can sort of breathe through? And if they do, does it defeat the purpose of the mask to begin with?
Right. So you got a different level of mask, and the lower level, the lowest, is going to probably block about 95% of these smaller particles, and then you go up from 95 to 98, and then you go up to 99%. You can't. I mean, the more you make the mask breathable, the less effective the mask is, because you're going to let larger particles, which can get through the mask, or even some of the smaller particles can get through the mask whenever is more breathable. So it will defeat the purpose. So it makes it difficult. I think at some point, the rule would be, hey, we're not gonna, if you're out in public in a crowded place, you got to wear a mask. If you're just outside in an area where you're at least 10 feet apart, say for instance, then there's no need for a mask. You to wear a mask. It's going to get to that point. And then when it gets to that point, I think, you don't have to really worry about that as much. But
So if the return to train,
it won't all be in general.
right, but if the initial return to train was maintaining, social distancing, you put them in a defined training space so that you allocate no more than 10 people within this defined space, and within that defined space, they're still 6 feet apart, it would be appropriate to recommend that they wouldn't need a mask at that point, is what I am understanding. Because you're,
You're so far away.
right, so would that be the proper protocol to start? So like if we're, maybe they wear a mask until they get to their spot, I don't know. So from the directors that are on the call and from the club standpoint.
So you don't know, not 100%.
I'm sorry, we're losing audio.
Yes, I think, sorry about that. Can you hear me?
I do, I hear you, yes.
Okay. So that's the very difficult thing about this, because at this point, we're not 100% sure that even 6 feet out without a mask is enough, because we're still learning things about this virus every day. I had a conference call earlier today kind of talking about this. So at this point, it's very difficult to say. As the weeks, 2 weeks from now, 3 weeks from now, 4 weeks from now, we will know more, and we'll be able to give more advice. And I mean, as we get more studies and looking at this, we'll be able to determine that, hey, if we say if we say, hey, 6 feet apart is that'll do it, then we know that'll do it. Right now, we're just guessing at this point. So I want to get things going from the get-go. If we say 6, you say 10, especially with your younger kids, because someone made a point. The younger the kids are, it's going to be tougher to keep them away from each other. So, I would just go the extra mile. If someone says 6, you say 10, and and until they kind of, I guess, lift the restrictions of, hey, mask in place, you got to have some type of protection. You need some type of protection with your distancing. So, it's really tough for me to sit here and tell you, hey, yeah, this is going to work, because we're not 100% sure. Right now, I can tell you 6 feet apart, we're just truly guessing. So.
Yeah, that's definitely part of the frustration of, I guess, this whole entire process, right? Because, operating from a place of fear versus operating from developing a plan and a protocol and a system is extremely difficult to do when you don't know what you're dealing with. But at the same time, you've got the side effects of that. Not only are businesses going out every single day, but there's the mental side of these kids not participating in a sport or getting exercise or fresh air, right? Like there is the benefits that come with youth sports that are really extremely important. So being able to start the process of bringing them back on and not just waiting 2, 3, 4 weeks until people know, I do think it's an extremely good point to say, go the extra mile. I think that would be, which is part of this conversation, right? So if it's 6 feet, then maybe we all agree, look, to be strong recommendations for the beginning, we're going to say 10 feet apart. Because at the end of the day, there has to be a plan in place. So, I mean, I do definitely like that kind of thought process. So, and then that kind of leads into, the personal responsibility and then the risk and liability that sits from the business side for a club. And that is kind of ties in with having the parent take the temperature versus, somebody facilitating that at the organization when they arrive. I think from a waiver standpoint, there's waivers that exist that are, there's realtors are following them, different, the hospital, when you go to the doctor, they're asking you questions. So maybe implementing a waiver process. We all now manage the organizations very digitally. We're in a digital age. You could put a waiver that the parent has to sign prior to attending each practice. And maybe within that waiver, they input the temperature that they took going to practice. So that could be a very practical, functional solution to involving the parent, transferring some of the risk, because there is going to be liabilities here because you are dealing with children. So, does anybody have any opinions on like that process and maybe applications to implement that process, whether you could do it through Team Snap or GroupMe or a manager, because you don't want parents handing you a waiver.
Right.
I mean, that's tough too. Everything's electronic at this point, and that definitely takes away from some of this, passing of germs. The biggest thing you got to think about from a liability standpoint is that you're working with kids, and if one of your kids gets the virus, gets sick, does that, what is that going to do for the program? What is that going to say about the program? So even if they sign a waiver or do this or do that, if they get sick, and it may be a better chance that they got sick running around the neighborhood with kids.
Well,
but at the same time, we can't say that, hey, it was at the soccer training, or was it you saying if a kid gets sick and has problems, or if a kid gets sick and unfortunately and dies, that's a big problem. Fortunately about this virus, it hasn't really affected youth as much. We feel like there are a lot more asymptomatic youth than we truly know, but they're asymptomatic. Mm-hmm. So which is good for us. You got to worry about the biggest thing. You got to worry about is your kids if they have diabetes. What we just learned this week is that Hispanics they don't necessarily get it quicker, or they're not more susceptible to it, but they get more severity and symptoms, which is something new that we've learned. And as far as the waiver process, you can always sign a waiver, and the way that can always be disputed. You just got to make sure that with the organizations is that you're not. We're not being negligent.
Certainly.
If, like, say for instance, if the government or if the governor or whoever, mayor still says, all right, well, you can't go out and without a mask. If you bring kids out there without a mask, even though they signed a waiver, you're still liable. So
certainly.
You got to be able to make sure you're as close to the law or as close to the recommendations as possible. But like I said before, we're going that extra mile.
The people that are running the business of youth sports are the ones that are helping dictate kind of what those guidelines look like, to send those recommendations to the COVID-19 task force and the governor and the city council, saying, look, we have taken an educated approach at this. We're looking at all of the scenarios. We want obviously everyone sitting in youth sports wants to protect the kids at all cost. That is the first priority. People are in this industry because they care about kids. I think, the risk of the liability of a kid getting sick or the finger being pointed at the specific club is particularly low, in my opinion, because the entire premise of this is that you don't know when you got it or how long you got it or how long you've been carrying it. So nobody can pinpoint where you picked up a virus. So from a liability standpoint, that part is minimal. there's then the personal responsibility start where, we have to look at how do you get the business side of youth sports back on track at some point for many reasons, physical, mental, social, economic. I mean, there's tons. And so looking at every single thing and then the process of that is, I think extremely important. Is there any other things that would be high risk for an athlete or a child?
Asthma, any type of lung disease. You would be wary of anyone that has any type of cardiac condition. Some kids have cardiac anomalies that doesn't affect them and it doesn't affect function and they're still able to participate. Those are things you want to think about. Obesity, majority of the soccer players are not going to be obese, obviously.
Right.
But, the biggest things we look at as in adults right now, obesity, diabetes, hypertension, those risk factors are pretty significant. Mm-hmm. But we don't see those in asthma. You'll see the asthma and asthma and diabetes. That's about it.
And maybe that's why the kids are more asymptomatic than the adults, because they're, less
contribute
in that category, which is again where we have to take, I understand there's the whole fear approach, but I really think it's important that we all take a common sense approach to this as well. And that, there's, as long as there's safety, there's protocol, there's looking at implementation and execution, there's a guideline that's defined by people that are in this industry and not just waiting for somebody else to recommend what to do that does not understand this business or how this business runs. I think that's why, it's important to have kind of these conversations. So another point is obviously bathroom use and minimizing that at the facilities. A lot of the facilities have porta potties, and everyone knows porta potties are nasty. So just, including the parents to engage them that they need to help minimize bathroom use at the facilities. I think that needs to be an important recommendation. And, unless maybe you add extra porta potties.
I mean, from our standpoint, we're not seeing it as much from a restroom, that kind of situation. As long as the kids are able to wash their hands or something after that, because it's usually from respiratory droplets or something to that effect. And, that's not usually in the bathroom setting, in a restroom setting.
Okay, that's good.
I would recommend maybe having more porta potties so that, you're not, so that you got more to choose from, and then just with your hand sanitizer or with your hand washing station, mayor, and that they use that and recommending that, because it may be tougher for those younger kids, to try to limit restroom use, because it is tough. An 8-year-old is a lot different than a 16-year-old. So.
Right. Well, the other thing that clubs could do too that utilize the porta potty service is increase their cleaning schedule. It's a little bit more cost, but they come, they hose them down, they clean them out, like they're doing all of it. So, adding porta potties and then increasing them to come 3 times a week instead of, once a week. That could be a, added layer of protection from the organization standpoint as well. So, I think that also talking about like the timeline, starting out with like no contact training, maintaining the social distancing, going above and beyond, then the step would be to have maintain the small distance and the small group, but increase contact. Again, we don't have an exact timeline in which we can say this is 2 weeks, this is in 4 weeks. I don't think any of that is determined. If that is lifted May 1st to May 15th, and then you're going to have to deal with the issue of the mask, depending on what that is, and that you can execute all of the recommendations and the recommendations are approved. How long do you think that we would have to stay with the no contact training? Does that look like that's going to be like an additional 30 days?
That's difficult to tell. The thing that they're going to base contact practices on is the number of new cases. Mm-hmm. Because as it levels off, it comes to a point where it starts trickling down. And as you start to be on that down, that's when, you're going to notice that all the restrictions get lifted a lot more. And that's when I would say that you're going to base on. Now, you can do other things before that. If you still got a sharp increase in new cases, that's if you this a big state. Obviously New York has a lot more people. Texas is probably, as far as the population, it is huge. But as far as the number of people being tested, Texas, of each state, we're 48 out of all the states. So it is a possibility that our numbers are a little flawed, but we got to continue to follow them. We are testing more people now, but you got to base contact on the number of new cases. When that starts to decline, or when you don't see more new cases, that's when you can start really implementing contact.
Okay.
Is that going to be 2 weeks, 4 weeks?
From my understanding, part of the problem is that you can't really trust the data of what is new cases and what is not, because, the hospitals are listing everything as a new case. It's easier to just mark it suspected. If they are suspected COVID, gets marked as coded as COVID. If they're confirmed COVID, they get less put in the same category as new cases. So that's just anybody's opinion, right?
No, that's not happening at our hospital.
You're only listing your numbers based on confirmed results.
Confirmed results, yeah.
Okay.
So that's been kind of at one point, someone had said that they were told any case that's suspicious listed as COVID, but they were talking about deaths. Mm-hmm. So as far as cases, everyone's only counting confirmed cases as true cases. Now, you may be a possible case, but until your test comes back, anybody suspected, they're getting tested. And until that comes back to show us, if it comes back negative, then you're not. If it comes back positive, then you're a confirmed case. So, no,
So I think that, kind of the final thought process on returning to train in this region. So taking it from the region that we're in, the one that we all have influences, is looking at what is the proper protocol, then putting that together, compiling that information, sharing the resources with like the hand sanitizer or the ability to live stream a game, or come together to where we're really sharing best practices, and then sending that protocol to the governor, the city councils, the task force, whatever that is, and then making sure that we're also all communicating effectively to the coaches, the players, the parents, and then actually the final step would be implementing that safe return. I think the big question that everybody that is on this call and everybody that is in soccer in this region is what that date is and what that looks like. And I think that the answer to that question is going to be dependent, obviously, on the masks and the social distancing and putting together these guidelines. And it might vary from city to city. If you're a club, if you're a Sting and you're in Austin and you're in Dallas, you might have to divide that up and do some region differently so that you still are, maintaining the guidelines of the city that you're in. I think that that's just going to be the kind of next progression of what this looks like. And, I think that the final kind of thought here that I would like everybody's opinion on is, what approval are you going to need and from who before you're comfortable allowing kids to come back on your field? I mean, from who is it that you're going to want that actual answer from? Is it the entire state? Is it the governor? Are you going to rely on the city? Is it going to be one? Because as of right now, as of May 1st, if it's a 10 person is the maximum and it's 6 feet, then is everybody willing to go back May 1st? Or are you waiting for some type of yes, you can? Is there an approval process that you're waiting to hear from? Pat, what's your thoughts on that?
I think in general, you're going to have, I think first the soccer people are going to have to allow us to get back out there. That's the first step. And then after that step, I think it's going to come down to each local government. And hopefully when they allow us to go out there, I think it will be small group training without contact and putting a lot of the things that we've talked about here today in place. I think at some point they're going to, hopefully we would be allowed to go back to contact practices and kind of follow the protocol, like I said, that we've discussed here today. Man, I'm not sure what's much different right now from us going out to train without contact than going to a Walmart or HEB or any other grocery store at the moment. But I can certainly understand and support their decisions at this stage. And I'm certainly not a doctor or a lawyer. But, I would like to think that if we follow some of these logical steps, soccer people release us, government officials release us. And unfortunately, in our area, this has fallen down political lines. You've got a Republican governor who seems to want to push things along. And in our particular community, you got a Democrat that's in charge of the county and wants to slow the process down. So I think it's just going to be different for everybody. But I do think this protocol is important. From Challenge's perspective, we're going to look to do all the things that have been mentioned here. And as soon as we possibly can, whatever that first day is, that we're able to go back to it.
Yeah, I agree. Hugh, do you have any thoughts for you guys to kind of look at the specific timelines based on where your facilities are located? Are you going to rely on like the county that you're in? Are you going to wait for like the governor? What's your thoughts on that?
Well, it's interesting for us because we have facilities in different counties, and part of this is also thinking about our members. If one county said we can train and the other said we can't, and particular teams train in certain areas, that's a decision as a organization we're going to have to make and based on it. But I think we are going to, like Pat says, listen to the soccer people of when we can get back out and then follow what the guidelines of the county will be for us, and then decide as a club, how do we make that happen when they say we can and go back out. If it's county by county and we're behind in one county versus the other, we're going to have to figure that out for the whole entire membership of making sure everybody's involved, because then, what you don't want. Because even in this discussion, one of the things that I was thinking about is, what if we go out there and one of these kids come down with the virus? Does that mean now that particular team is shut down? Does that mean the whole organization has to shut down protocol? Those are some of the things that we have to figure out as well, is if somebody does get it when we return, what's that protocol going to look like? And what are we going to do?
I think that's the reason to maintain the social distancing and do the defined marked spaces, so that you can kind of help control that, so that it is, as spaced out as far as possible. And then if something comes up, then that's a smaller group to manage than bringing hundreds and hundreds of people together at the same time, and, practice starts and stops. And, that's the whole point of this, that you don't have the large group settings, and then as far as like the comments on the governing bodies, and I'm assuming we're talking about like soccer governing bodies, I don't think that they're going to dictate when you can come back and start. I personally don't see that that's going to be something, because you're not playing game. They can dictate when games start, but they can't dictate when a club starts. They can't control that. And again, they're going to take the thought process of the entire country. And New York is going to be completely different than Texas. It's just the execution is different. The facilities are different. I think that if everybody's going to wait on the governing bodies, it's going to be months and months and months and months. And I think there'll be maybe not youth soccer left at that point, or only the people that have deep, deep pockets.
In our conversations with U.S. Club Soccer, mm-hmm. They currently will not allow anybody that's registered with them to train, and they're the ones that are actually providing liability insurance and supplemental health insurance. So you're not allowed to do anything until, I think, May 4th. In conversations with them, they think that their ban will be between the 4th and the 15th.
Okay, that's good.
They will turn that back over to local officials. They don't seem to be doing this out of concern of liability, mm-hmm. out of just concern for individuals' health. Is in conversations with them. So we're going to take the advice of medical people, the government officials, all of that. I think everybody's got to take that in. Unfortunately, I think there's going to be conflict, mm-hmm. and then at some point, I think people are going to either go one way or the other. And if we go one way, we may not be playing soccer for the next year. If you go the other way, and because somebody will get sick and somebody will assume it happened at a soccer practice, but somebody's going to get sick going to Walmart or HEB or whatever. And I think at some point people are going to say either we are back to our lives and we're going to get back to them, or we're not. And
Right.
At some point, that's one of those two very different directions is going to win out, I think. And I'm not sure which direction it'll go.
Yeah, I mean, I'm hoping it's not the direction of that everybody just gives up. I think that, again, the mental side, the physical side of youth sports is extremely important, and it vital to the health and well-being of the children that we all serve, right? Like they are, and I'm talking as a parent, I'm talking as somebody that's been in youth soccer for many years, and as you guys have all are much more in it, I think that it's time to really just, I don't know. I mean, I'm confused on it because, I understand the liability and the risk, but I also am just so moved by the need of these kids and their mental health and their physical health and helping serve and solve that problem. I mean, to me, it's just, this whole thing is just terrible. So does yeah.
I was going to chime in. We've had a great discussion today. I think you guys have really hit on a lot of points. For me as an athletic trainer, my recommendation at this point is if you're looking at from a protocol standpoint, I think we need to organize it in a way that's easy to communicate to parents and coaches and even to the community on what we're doing. And it kind of rolls down to, I just kind of taking some notes, but pre-training session, what are you doing at home? Washing your hands? Are you taking your temperature? Are you filling out that pre-participation survey before you go to the field through, online with your club, so that it's documented? Our employees at the clinics, we have to take their temperature when they arrive, and we take their temperature at the end of the day. Mm-hmm. But you kind of have your pre-training ritual of what you're going to do. Then you want to potentially talk about what do you do once the athlete arrives to the facility? What does that look like? Entering the complex, exiting the complex. What do they do during the training session? And that's where, the water breaks, the bathroom breaks, spacing, things like that. And then talking about what are you going to do at the end of the training session to make sure that the kids are staying away from each other, and then speak to how do they exit the facility? And then even what does it look like when they get home? Do they leave their cleats outside? Do they do those things? And I think as you guys are putting your protocols together and you're thinking about how am I going to communicate this with my parents and my organization, I would say shift to that flow. And Chris had mentioned that a little earlier about what does it all look like as we're bringing things back on. And I think if you've got an established protocol that looks at all the different facets of what it would look like from leaving your house to coming to train and going back home, I feel that's going to be more receptive to the parents, to the players, and to those in the community that will be looking at soccer and youth sport of what are you doing to get ready to come back? And if you've got this protocol to speak to, I think it'll be a much more beneficial conversation to have.
Yeah, I definitely agree. And I think that's kind of the point of this, is that we can, I'm more than happy to compile all of this information and put it not only in the slideshow format, but also into an easy one-page document that everybody can take and edit and manipulate to their what they see fit for their organization. We can compile the resources that we have, and if anybody gets them, feel free to share them with other people for the hand sanitizer, the video, masks, whatever different resources that you find. I also will add on that resource list the waivers and maybe some processes or protocol for that to implement. That could be accomplished through, again, most people have Team Snap, you have GroupMe, everyone has Google Docs. You could do it through a e-signature form. There's a lot of applications that are simple to solve that problem, but just being able to kind of compile it, and then people can pick and choose of what's best for them. And I think the other reason it's important for this kind of conversation is that everybody is so busy right now talking to the parents and talking to their players and doing Zoom calls, and there's the work side of it, that if we can just work together to pool our resources, it'll just make the process better for everyone. And then everyone is communicating a clear and concise message to the public and the parents and the coaches and the players. It'll just really speed up this process. So I thank everybody for their time today. I think that these conversations are invaluable, and I will put that information together and share it. So if anybody has any final thoughts, I'm happy to add to it, but I really definitely appreciate the conversation.
Well, thank you, Jennifer. And from our perspective within our organization, we believe discussions such as these are essential in getting back to our lives. And obviously the biggest priority is our kids. And we'll follow the medical experts, obviously our government and the allowances allowed. But one thing we also discussed was just the fear factor of the families coming back, and some families aren't going to be ready. And for our organization, we discussed not mandating it. If a team is allowed back out and a family still has a extreme fear factor early on, it's not mandated that player must attend.
Hey, I have a question. Okay, what do you think about utilizing Zoom somehow? Because everybody's doing their Zoom calls now anyway. So for the players that aren't comfortable coming back out, maybe you still do a Zoom session so they can kind of feel a part. Because again, you could have a parent that's worried, but then the kid's going to be upset, so that they could still feel a part of that process.
Absolutely. And it's discussions like this that spark ideas like that. So, so thank you very much for putting this back on for just the betterment of our game. And it's important. It's important that our kids get to enjoy the game they love again. So thank you very much for this.
Yeah, definitely. Anybody else have any tips or thoughts that we didn't cover?
I just want to say thank you, Jennifer. I feel like this is a great conversation because there's things that we really need to talk about as far as transitioning back into, normalcy.
Yeah.
I think a lot of things that we talked about today were very important, and we still can continue to brainstorm and try to figure out the best way to get these kids back to doing the things they enjoy in a safe set. So thank you again.
Yeah, definitely. I appreciate you guys. Okay, well, then I think we're done. Thank you guys for your time.
Thanks, everybody.
Thanks.
Thank you very much.
Thank you, Jennifer. Thanks,